Hi everyone, in this video I am going to discuss a case study on vitamin D. Case presentation. A 10-day-old baby was admitted with new onset convulsions. In the previous 6 days, his parents had noted left-sided arm and leg twitching, right-sided head turning and lip smacking. These episodes lasted for approximately 30 seconds and their frequency had increased to 7 times per hour before admission. There was no history of fever, trauma, sick contacts, or neonatal sepsis risk factors. The baby was breastfed and supplemented with formula feed. The pregnancy was unremarkable and the baby was born at term by an uncomplicated cesarean section because of a previous cesarean section. His birth weight was 4.1 kg. On admission, seizure as described were witnessed. He was afebrile with normal vital signs. He had no dysmorphic features and thus physical examination was otherwise unremarkable. Blood biochemistry. Initial blood biochemistry showed normal renal function and electrolytes but with hypocalcemia. Total calcium is 1.8 millimole per liter, whereas the normal range is 1.96 to 2.66 millimole per liter, and ionized calcium level is 0.82 millimole per liter, whereas the normal range is 1.62 to 3.10 millimole per liter. His blood glucose level was within normal limit at 4.3 millimole per liter. There was low 25 hydroxy vitamin D level, 13 millimole per liter. Normal is 27 to 110 millimole per liter with a normal 1,25 hydroxy vitamin D urinary calcium. Head ultrasound was normal and there was no clinical or radiological evidence of rickets. Maternal investigations demonstrated normal calcium level of 2.27 millimole per liter and 25 hydroxy vitamin D was low. The diagnosis was further revealed after further maternal history. The mother was noted to have diet low in calcium and she reported not taking any antenatal vitamin supplement. She also reported always wearing sunscreen when outdoor. The baby had not been started on vitamin D supplements. So now the case discussion. The question is, what is the cause of hypocalcemia in this baby? Hypocalcemia, serum total concentration of less than 8 mg per deciliter in terms of infants or less than 7 mg per deciliter in preterm infant. It is also defined as an ionized calcium level of less than 3 to 4.4 mg per deciliter depending upon the method used for estimation. So if the total serum concentration of calcium and ionized calcium level is less than 8 or less than 3 respectively, it may lead to hypocalcemia. Causes: infant with severe symptomatic hypocalcemia due to maternal hypovitaminosis D. Mother is reported to have been wearing sunscreen outdoor. How did the mother get hypovitaminosis D? Sunscreen with a sun protection factor of 8 reduces cutaneous production of vitamin D by 98%. So she did not supplement with vitamin D during pregnancy. Test: 25 hydroxy and 1,25 hydroxy vitamin D levels, serum and urinary calcium level, PTH level, renal function tests. Results: low 25 hydroxy vitamin D level in the baby indicates that vitamin D stores are low. Note: normally 1,25 hydroxy vitamin D confirms that the child is able to convert vitamin D to its active form. The child's parathyroid hormone, that is PTH, was appropriately elevated. Signs of hypocalcemia, that is hypotonia, apnea and tetany. Risk factors of neonatal hypoglycemia. Symptomatic hypocalcemia without evidence of ricket may present in the early neonatal period. Risk factors of neonatal vitamin D deficiency secondary to maternal hypovitaminosis D include having a mother with dark skin, being born in winter month, living at extreme latitude, maternal diet low in vitamin D during pregnancy and lactation, and lack of maternal sun exposure. Clinical manifestations of neonatal hypocalcemia: jitteriness, muscle jerking, generalized or focal seizures, TRED or secondary to laryngospasm, wheezing secondary to bronchospasm, and vomiting secondary to pylospasm. So these are the clinical manifestations. And treatment is IV or oral calcium supplementation. The baby was managed with an IV calcium gluconate infusion, oral calcium, vitamin D calcitriol supplementation. The seizures are resolved within 48 hours of admission.